Welcome Lifesavers to our first cardiovascular common disease video. My name is Nurse Kelly Tyrrell, and today we're going to be talking all about coronary artery disease, or CAD for short. Coronary artery disease is the most common type of heart disease, and it kills thousands of people each year. Actually, about 18.2 million adults aged 20 or greater are affected with coronary artery disease, and 2 in 10 deaths occur in adults less than 65 years of age. So given the prevalence and mortality rates of this disease, it's a very highly tested topic in nursing school and on the NCLEX. So what exactly is coronary artery disease? Well, CAD is the plaque buildup in the arteries that supply blood to the heart. We talked all about the major vessels and arteries of the heart in the cardiovascular pathophysiology lesson. If you didn't catch that lesson, I'll link it above. And the important role that they play during the cardiac cycle, pumping all of that blood throughout our body. So if there's plaque buildup, that will narrow these arteries and decrease blood flow to the heart. If the heart can't adequately pump blood and other nutrients throughout our body, then there's detrimental consequences to that. So there are several risk factors that put patients at risk for developing coronary artery diseases. And these risk factors include gender. So men are generally at greater risk of coronary artery disease. However, the risk for women increases after they hit that menopause age. Family history is another factor. So a family history of heart disease is associated with a higher risk of coronary artery disease, especially if a close relative developed heart disease at an early age. Your risk is highest if your father or brother was diagnosed with heart disease before age 55, or if your mother or a sister developed it before the age of 65. Another risk factor is smoking. So people who have smoked have a significantly increased risk of heart disease. Breathing in secondhand smoke also increases a person's risk of coronary artery disease. Another risk factor is high blood pressure. So uncontrolled high blood pressure can result in that hardening and thickening of your arteries, and it narrows the channel through which the blood can flow. Another risk factor is high blood cholesterol levels. So high levels of cholesterol in your blood can increase the risk of formation of plaque and atherosclerosis. High cholesterol can be caused by a high level of low-density lipoproteins, or LDL cholesterol, and that's actually known as the bad cholesterol. A low level of high-density lipoproteins, or HDL cholesterol, which is known as the good cholesterol, can also contribute to the development of atherosclerosis. Another risk factor is diabetes. So diabetes is associated with an increased risk of coronary artery disease. Type 2 diabetes and coronary artery disease share similar risk factors such as obesity and high blood pressure. Another risk factor is being overweight or obese. So excessive weight typically worsen other risk factors. Another risk factor is physical inactivity. So lack of exercise is also associated with coronary artery disease. Another risk factor is high stress. So unrelieved stress in your life may damage your arteries as well as worsen other risk factors for coronary artery disease. And the last risk factor is having an unhealthy diet. So if you're eating too much food that has high amounts of saturated fat, trans fat, salt, and sugar, it can increase your risk for coronary artery disease. These risk factors often occur together, and one may trigger another. So for instance, obesity can lead to type 2 diabetes and high blood pressure. When grouped together, certain risk factors make you even more likely to develop coronary artery disease. So for example, metabolic syndrome. So that is a cluster of conditions that includes high blood pressure, high triglycerides, low HDL or that good cholesterol, high insulin levels, and excess body fat around the waist. Those all increase the risk of having coronary artery disease. At first, the decreased blood flow may not cause any symptoms, but as that plaque continues to build up in the coronary arteries, patients may start developing very noticeable symptoms. And eventually, the reduced blood flow can lead to something called angina, which is another name for essentially chest pain. Patients can also experience shortness of breath, and a complete blockage will cause you to have a heart attack, which is the necrosis or death of that heart muscle itself. So the key signs and symptoms of coronary artery disease is chest pain that may be substernal, so below your sternum. It may feel like a crushing pain or compressing, and it may radiate to the left arm, neck, jaw, or back. The chest pain usually lasts about 3 to 5 minutes and will usually occur after exertion, emotional excitement, or exposure to cold, but it can happen at rest or at any time. So what are the key test results, treatments, and interventions you will need to know as a nurse? Well, as far as test results, you're going to want to monitor the patient's blood chemistry levels. What you're going to want to monitor specifically is abnormalities in the cholesterol levels. So patients with CAD typically will have a decrease in their high-density lipoproteins, or HDLs, which is that good cholesterol we just talked about, and they will have an increase in the low-density lipoproteins, or those LDLs, which is that bad cholesterol, which we just talked about. The next result you'll want to monitor is that patient's ECG readings. So patients with coronary artery disease will often show a depression in their ST segment and an inversion in their T wave during a reported episode of angina. So now, what are the treatments for these patients? Well, you'll want to encourage and educate these patients on changes in their activities, including weight loss, if the patient is overweight or obese. You'll also want to educate on dietary changes, including establishing a low sodium and a low cholesterol, low fat diet, and you want to increase that dietary fiber. If the patient also suffers from being overweight, you'll want to add in a low calorie restricted diet as well. And next, you'll want to apply some good old-fashioned oxygen therapy, typically by a nasal cannula. The heart is being deprived of that oxygen-rich blood in the patient who is suffering from coronary artery disease. So by adding that supplemental oxygen, it's really going to help the patient's heart beat easier. The next treatment modality is pharmacological interventions. So you'll want to make sure that these patients are on an anti-lipemic agent, for example, statin drugs like lovastatin or simvastatin. You'll also want to make sure the patient is on an antiplatelet aggregation such as Plavix or aspirin. What these medications are going to do is thin that patient's blood to prevent blood clot formations in the heart, because remember, their blood's going to be really thick because of the coronary artery disease. And lastly, you'll want to ensure patients are on a beta blocker such as atenolol or metoprolol. So beta blockers work mainly by slowing down the heart rate. They do this by blocking the action of hormones like adrenaline, which makes the heart beat faster and harder. When the heart is struggling to pump oxygenated blood because of the pressure on the arteries due to that plaque buildup, we want to slow down that heartbeat so the heart can pump slower but more efficiently. And lastly, let's talk about some key nursing interventions for these patients. So the first common intervention is you'll want to obtain an ECG when a patient complains of that anginal episode or that chest pain. And remember, you're going to be looking for that ST segment depression and the T wave inversion. Next, you'll want to make sure you're consistently checking vital signs, including blood pressure, heart rate, respiratory rate, and pulse oximetry. You'll also want to make sure that the patient is on a continuous telemetry monitor to catch any kind of cardiac arrhythmias that may occur. Next, you're going to want to monitor the patient's intake and output, and primarily you're going to be doing this to make sure that the patient doesn't start retaining fluid, because as there's an increase of stress in the heart, it may not pump as effectively, which will cause fluid accumulation within the body. So this will cause the patients to have significant peripheral edema, shortness of breath, and crackling in the lung lobes. And lastly, you'll want to administer nitroglycerin for angina episodes. So nitroglycerin is a medication, and it works by relaxing those smooth muscles and blood vessels in your body. So this increases the amount of blood and oxygen that reaches your heart. In turn, your heart doesn't have to work as hard, and that reduces the chest pain. And that concludes the end of this lesson. I hope that you found this information extremely valuable and it made you just a little more confident as you prepare to take your NCLEX. I just want to thank you so much again, Lifesavers, for tuning in today. My name is Nurse Kelly Tyrrell, and I help nurses feel more confident, increase their test scores, and retain what they don't remember in nursing school. If this video helped you in any way, be sure to give it a thumbs up. Also, don't forget to smash that subscribe button and click that notification bell so you don't miss out on any of my upcoming content and future videos. And why don't you go ahead and do me a favor and drop me a comment below. Just let me know where you're at with your nursing journey. I'd love to say hi and just connect with you. Also, make sure you click that share icon to spread the word and encourage a fellow aspiring nurse. And last but not least, when you are ready to take your NCLEX, be sure to check out my NCLEX and Show review, where I help eliminate eliminate test anxiety, and review detailed test-taking strategies so you can have that unfair advantage to pass your exam on your very next attempt. Not ready to end the study sesh yet? Well, you are in luck, because if you stick around, you can watch more of my videos coming at you in 3, 2, 1. Bye, Lifesavers.